Hello and welcome, everyone. Thank you all for joining our Closing Out the Year with Confidence Financial Cleanup Ideas webinar today. My name is Sawyer Barkus. I am a product marketing specialist with ChiroTouch and super excited to be here with you all today. I want to go ahead and extend a warm welcome to Rebecca Scott with us today from KMC University.
Thank you, Sawyer, and welcome everyone. I'm super excited to be here and talk about one of my favorite topics, which is the end of year compliance and financial cleanup. So today our objectives are why writing off those chicken feed balances may be best for your practice and your patients. How to proactively update patient demographics and insurance information for the new year, and also how to manage those end of year accounts to prepare for a successful 2025. So hard to believe that it's already 2025. So we are going to learn about running those financial cleanup reports. So running the AR reports or the accounts receivable reports, not only just the payer accounts receivable, but also the patient accounts receivable. How we can clean up those balances and review our financial policies. So with our financial cleanup options, we're going to recognize our AR. We're going to create a plan to handle those outstanding balances, and we're going to review amnesty and balance forgiveness options. So first of all, we want to run our accounts receivable, and we have this great screen share of from ChiroTouch Cloud, and we want to look about running those patient AR and also the payer AR. And we want to organize it by balance due and by payer. So if it's Aetna, Cigna, Medicare, those kinds of things. So making sure that we are running the report so that we can best use it. And here's just a quick questionnaire or a snapshot of how we can look at our accounts receivable. So we want to create a follow-up process. So running the report and then finding out how much is over 60 days, how much is over 90 days, and so on. And then how much is due from insurance, and then how much is due from those PI cases. So obviously with our PI cases, those may be over 60, 90, 120 days old as we're waiting for those claims to be closed. So that's our target area that we want to look at. So with our end of year insurance cleanup target, and then for our insurance companies and also for our patient. So now once we have those accounts receivables broken down by patient, by insurance company, we may want to consider having an amnesty policy. So this can be part of your financial office policy, and it implements only if collection, if it fully fails. So you've sent patient statements, you have a great patient statement process in place. You know, we send out the first statement, we send out the second statement saying that it's past due. Third time we give the patient a phone call, they don't answer our call. We may want to consider having that amnesty policy. And obviously, these policies need to be supported with a written policy and procedures, and we want to document everything that we do. An amnesty, it's a general pardon for an offense, an act of forgiveness or absolution. So we want to select those past due accounts and also set up that reduction percentage and make sure that we set a short time limit for it. So it's not like for the rest of time. And here's like our sample scripting is in the spirit of the holiday season and in preparation for the new year, Dr. Smith is offering this one-time amnesty program. Pay your balance in full by December 31st and take X amount or a percentage off your amount you owe. Take advantage of this courtesy as we will not be able to offer this in the new year. So making sure that we document everything. And then, of course, with those higher balances, we can also offer payment plans. And remember that payment plans are not a high-risk area of finances for compliance. So making sure it's great for those larger balances and offer with a time limit for acceptance. So patient has a high balance. If you want to set up a payment plan, 100% just need to get to the office, let us know by the end of the year so that we can set up that payment plan for you. And prepare to have those payments automated. And as we're offering these automated plans, we want to prepare an agreement. So making sure we have it in writing. We offer those flexible plans to get the automation in place. We want to mail or email or mail a patient a copy of their payment plan. We want to protect their financial information, obviously use scripts. And the important thing, or one of the greatest advantages of this, is it keeps cash flow moving. So instead of a patient having a higher balance, we know that every month we're going to get X amount of money from Mrs. Smith. So here's the great sample of that. Thank you for the payment, Mrs. Smith. With your permission, I'd like to set this up to charge your card the same amount each month until your balance is paid in full. That way you won't have to worry about it, and we'll be happy to apply these payments towards your balance due. If the patient says that that amount is more than she or he can afford monthly, use the option to ask about what would be affordable for them. And then we have the year-end balance forgiveness. So this is what we call that chicken feed cleanup. We want to make sure that we're using it sparingly, and we want to notify the patient. So I like to think we might be a little late at this, but we create a list back in November, meeting with the doctor to go over like these are the patients that owe us money, and meet with the doctor and maybe over a lunch period and say, what do you want to do? Because the doctor may know more about the patient than the billing department, right? Making sure we have those balance forgiveness and amnesty. Like I said, the doctor may know things that we don't know regarding the patient, and that we have everything in writing and that we notify the patient. So we want to reduce the risk with a financial policy. So we want to explain our expectations. So when the patient comes in for the very first time, we want them to understand that they've come to the right place. Patient understands what their financial responsibility is for that day's visit, and that details will follow in their financial report of findings. Always encourage that the patient pays something towards their financial responsibility on day one. And then at that point, the patient may want to join ChiroHealth USA if they wish to accept the discounted fee, if appropriate, and that the patient signs the general office financial policy every year. And as a consumer, I would like to know what's expected of me. So having that financial office policy really sets those boundaries and affirms the agreement. And an informed patient tends to be a compliant patient, and really having those clear expectations of policies allows for flexibility and, if necessary, on a case-by-case basis. So along with that, we also need to have our internal financial policy. So the difference between contracted and actual fee schedule, and this is part of the compliance form for and that is an in-office form for your compliance. All right, and we want to create a compliant hardship policy. So the hardship policy is published at the end of January, usually goes by the federal poverty guidelines, and it sets a scale for what the patient may have for income to set the scale for their hardship policy. And we recommend having it for a specific time period. So like an episode of care, that the hardship does not go on forever. And remember the No Surprises Act, or the good faith estimate for all self-pay patients. So refresh yourself at the end of the year what you know about the No Surprises Act and the good faith estimate to make sure that you're doing it properly. Remember, we have to ask all new patients who are not using their insurance if they would like a good faith estimate. And this is our front desk decision-making matrix, which I totally 100% love. As we're looking through, if they don't have insurance, ask for insurance information. And if they say no, would you like an estimate of your out-of-pocket costs? And this is our new patient data collection form. It will bring us up to, do you have some kind of insurance that you'd like us to assist in filing for you? If they say yes, great, let's get all of their information so we can verify them prior to them coming into the office. If they say no, that's when we have to ask, would you like an estimate of your out-of-pocket costs? We also want to set goals. So obviously, don't be afraid to say, hey, my personal goal is to make sure that all of these, like, I don't have anything in 60 and older for my for my patient balances. Can you help me get to my goal? And I know you want to get this balance resolved before the holidays as well. And Dr. Brian is going to show us how to make those notes in ChiroTouch as well. All right, so now that we have a solid knowledge of what is required of you and by whom, let's see if you're living up to those requirements. So we know that the OIG, or Office of Inspector General, has these 7 steps. So we want to review these steps. So one of those is the baseline audit, and that provides the initial assessment of threats to the OIG compliance. And in order to maintain compliance, regular audits must take place. So this list is not all-inclusive. So as you work with a compliance specialist, they will take a closer look at evaluating your evaluation and management usage, your documentation, routine office visits, and generally most audits do fall into these 3 categories. So we have documentation, coding, and EOB review. So with our documentation reviews, we just want to do a spot check of the documentation audit. So some of the key things is, are the notes signed? Obviously with CMS, Centers for Medicare and Medicaid, they have you are obligated to sign your notes within 24 to 48 hours. So making sure that the notes are signed. Are there any alterations or deletions? And if they are they initialed by the provider? So really just doing a spot check of your documentation. And what should be reviewed in that coding audit? So Dr. Brian is going to show us how to find these reports, but running a report to see what E&M codes are we using. And our statistics of our E&M coding should match. And what's our ratio of codes within a code set? How many evaluation and managements? What's our chiropractic manipulative treatment? How about modalities and procedures? What's our modalities versus our procedures? Those kinds of things. And we like to look at these on a biannual basis. So with those coding audits, obviously we're going to use ChiroTouch, and we should be able to, and Dr. Brian's going to show us how to find those list of codes and their usage. We want to run the report by month and the number of times each code was used. We're going to use columns for the month of the year, and then the rows should be each code we use. And make sure it's grouped by code sets. So I'll show you some examples. So in this example, let's look at an audit of E&M services. Now, when we compare the total number of new patients to established visit patients, we see that we presume that they were 755 people classified as new or hadn't been in 3 years. With this little bit of data, we're going to see how these numbers tell me that we both have risk and opportunity here. So we can definitely see some red flags on this slide. If I were to tell you that this office's patient visit average was about 25, meaning that the average new patient stays for about 25 visits, wouldn't we assume that at least these new patients alone, we should be able to see at least double the number of established E&M codes as new patient codes, as one reeval at about the 4 to 6 week of care, and then one at the discharge. So if we look at those numbers, we can see that at least 676 established patient visits for the E&M services. Say that average is $62, then we are losing $41,912. That's a lot of money right there that we're leaving on the table. So know that coding is the first step to communicating the patient's condition and treatment to the insurance company, right? The insurance companies or the payers cannot see your hard work, our documentation, hopefully, with a simple, clean claim. We need to tell that full story by coding correctly. We want to know the payer's coding rules. So higher codes require supporting documentation. So audit your coding and your documentation at the same time, and really look for those medical review policies to make sure we are following the rules. All right, so anytime there is a ratio as high as this, it's a red flag. There are many assumptions that can be made about this practice without looking any further. We won't know for sure. So first, I can deduce that this practitioner is a full spine adjuster. Because so many providers practice full spine adjusting, it's often confusing to clarify which of these three regions are deemed medically necessary when it comes to third-party reimbursement. For medical necessity to be established, there should be a complaint in a spinal region, followed by positive exam findings in that region, followed by a diagnosis and an indication of rationale for why that spinal region is being treated. More often, patients come in with one or two complaints, and the provider identifies subluxations in other spinal regions, right? Unfortunately, they often do not go back and document whether there is a complaint in that area, but they bill it anyways. If this provider's records were requested by a third-party payer, it's very likely there would be questions. Once again, if the provider owns their statistic indicated a 99.5% ratio of a 98941, surely the payers of this provider also know it. And we can also see that they didn't bill any 98943s or those extra spinals. Let's look at this provider's modalities and procedures. Take note, for this provider used 97140 or the manual therapy, and let's remember he had a 99% use of the code 98941, which indicates the 3 to 4 body regions. So 3,435 times in that same period that patient had manual therapy. It can be assumed that they were adjusted on the same visit. We all know the rules that indicates we cannot provide manual therapy in the same body area as adjusted. In some cases, it cannot even be in a contiguous body region, such as the rules that exist for Optum and some other payers. So as an auditor, I have many questions as I look at these numbers. In this case, the provider may be incorrectly providing this service and billing for it when it is a bundled service. But it also, we don't want to jump to the conclusions because we also know that the provider never billed those extra spinals. So maybe that manual therapy was done in an extra spinal region. So we don't want to assume, but we want to look. And remember, by the time a third-party payer looks at this, it may be too late, right? Because they have their algorithms, and even now they have the artificial intelligence or AI looking at these patterns as well. So we want to audit your way to evidence-based practice. So when we're auditing, we want to identify our red flags. We want to identify areas for improvement, and we want to improve patient outcomes and quality of care. We want to revise the office coding policies and procedures and impact the payer opinions and coverage policies. So the last part of that is the EOB audit, so explanation of benefit audits. So let your eyes fall upon these areas of your EOB audits. Was there a payment or was there a zero payment, and was it correct? Was the allowable amount paid? If the allowable amount was paid, making sure that we have those fee schedules set up in ChiroTouch to make sure that they're accurate. If there was a balance to be assigned to the patient responsibility, was it completed correctly? And if there was an amount that was written off, was it written off correctly? So here's just our audit review that we use as we're doing an EOB audit, and we ask specific questions, and we recommend 10 EOBs at a time. And some additional questions is, if the EOB had one or more service denied, was it denied appropriately? If so, was the write-off handled correctly? If the denial was inappropriate, has the claim been set aside for an appeal or follow-up? And if any portion of the claim was paid incorrectly, has the claim been set aside? So one thing to remember is we don't just necessarily have to write off balances. Sometimes we have to do some follow-ups. So after the post audit, some of the necessities that we have to do is make refunds. So if we find that there's a refund, we need to make it. We have 60 days once we've identified an overpayment to refund that to the insurance company. Make sure that we refund them. We need to take action. So if there's something going on, we might need to, take action with a provider to say, can you update your coding or documentation patterns? And we want to change the focus of the audits to ensure and problem areas identified in the self-audit may help determine the scope of the next round of auditing. And of course, we want to take action. For example, a physician with a pattern of undercoding may be asked to review the appropriate CPT and ICD-10 codes, as well as the documentation guidelines in each payer that he or she bills for, to strengthen his or her coding skills. Now, we understand there may be some misinformation regarding HIPAA out there. So HIPAA is the other side of compliance. And here at KMC University, we have the best HIPAA specialists in the country. So we're very fortunate to have Jill with us. So we want to review the HIPAA updates and requirements. Remember, the final rules are posted online, and take note of the difference between the proposed rule, so what is still in development, and the final rule and what date it's going to be enforced. Don't forget your breaches. So if there is a breach, we need to make sure that if even it might be reportable, even if it's under 500, and you're required to report those to HHS within 60 days. So we just want to make sure that we're following the rules and always look for a HIPAA specialist. So let's make your end of year list. So now what are we going to do, Rebecca? We've gone through that. So we want to do our annual OIG compliance duties. So we want to make sure we've checked all of our employees, including our physicians, on the OIG exclusion list. Check all the staff to make sure they're not excluded. We want to complete that baseline audit of 5 to 10 charts per provider. We want to conduct our coding audit. We want to review those provider contracts and update policies if necessary. Review all existing policies and procedures and update as necessary. Review the code of conduct and have all employees sign a new one starting at the beginning of the year. Conduct that formal compliance training with the entire team and confirm that key team members have completed the annual training. So this is our HIPAA checklist. And remember, this is not all inclusive. So again, check with that HIPAA specialist for assistance. So check the yearly risk assessment, create a corrective action and assign to key staff members to complete, train staff on the HIPAA security safeguards, review the business associate agreements and confirm that agreements are on file, review that contingency plan and update as necessary, and file all reportable breaches within 60 days by the end of the year. So our financial checklist. So we want to, by now, you should have already have your 2025 Medicare allowable fees. You can find those on your MAC portal. We want to confirm your ABNs are correct and reflect the Medicare's fee schedule. So remember, on the ABN, you either can charge your Medicare allowed amount or your full fee, making sure that your ABNs have the correct fee. We want to review for payer updates and fee schedules and update ChiroTouch when we do have a fee schedule update. We want to review that hardship policy, locate those poverty guidelines for the new year, and update our financial policy. This is a great opportunity for us to review our intake forms, our consent forms, and update them as necessary. Identify all plans that require those pre-authorizations or advance notices. Review those No Surprises Act requirements and making sure that we understand and that we're compliant with that. And review all new ICD-10 and CPT codes and update ChiroTouch and all of the forms. So I love this slide. So having that New Year's resolution, and Winston Churchill says, to improve is to change. To be perfect is to change often. So things to remember, do not ignore the compliance requirements and be open-minded and willing to make changes. Create a compliant culture in the clinic by getting others involved and seek the advice of the compliance specialist if you're feeling overwhelmed. So we do have a Facebook group that is moderated by specialists and coaches. Know that this is a group where only the specialists, you have to ask to go in, and that's why it's a moderated face group where you can ask questions. And if you are a KMC University member already, you do have access to the help desk, but this might be where you can form a group and be part of the group and ask your questions there. And then, of course, the library. So you don't need to know all of the answers. You just need to know where to find those answers. So as ChiroTouch users, we do offer a 1 month free of the library use. So you can scan that QR code for a free month of the KMC University Library. Thank you so much for having me. It's been a pleasure working with you all or spending this time together. And I'm going to move it back to you, Sawyer.
Amazing. Thank you so much. I'm going to go ahead and pass things off to Dr. Brian Blask. Brian, feel free.
Thank you, Sawyer. Thank you, Rebecca. You are a fountain of knowledge. Really appreciate that. And everyone at KMC, I mean, such great people, and they're such a great compliment to what we do here at ChiroTouch. You know, that library and everything you guys produce there is incredible. So thank you so much. I'm going to just run through a couple quick things here. I'm the sales manager here at ChiroTouch. I've been with ChiroTouch for almost 10 years. So on the screen here, you should see ChiroTouch. Top left corner, you should be able to see it says ChiroTouch Analytics, Scheduling, Patients Charting, and Practice Ledger. That's how you navigate through the software, right? So in ChiroTouch, it's completely web-based, which means you don't have to have a specific type of computer or anything like that. So you can be on any type of computer, anytime, anywhere, and you navigate it kind of like you would Gmail or Outlook. It's on this left-hand column here. A lot of what Rebecca was talking about is in the patients section. So in your patient section is where you'll get a lot of demographics that update insurance information. So I'll come in there and update your insurance info, documents, right? When she's talking about adding different documents like hardship policies, updating those types of forms, make sure your intake forms, all those intake forms are included with our CT informs. So patients can fill those out electronically and it'll come right into the system. Make sure you're using that because it's a huge time saver and it puts all that information right here into the document section. And then a big part of what she's talking about is reporting, right? End of year reporting. So you want to make sure that you're using the analytics portion. So the analytics at the top is going to give the different types of PDF style reports as well as the dashboards. So when she's talking about running different types of reports, end of year activity, those types of things, come in here and use all these. There's about 30 of them right now, and we add them all the time, right? We've got multiple developers on this product that are working in 3-week sprints that keep continuously pushing out new updates all the time. So when we add to these, you'll see that in the bottom right corner, you'll see that question mark down here, and that'll be your resource center. So it'll always show you what's new in ChiroTouch. It'll show you lots of different information. So when you add staff, you can give them all the information right here with different videos and courses, product updates. And when that happens, you'll have different reports that come in here. What she was talking about, one of those was that procedure code productivity. So run that, and that'll be all right here for you. Aged outstanding claims is another popular one. Sales tax liability at the end of the year. And all those live right here on the analytics on the report section. If you're a type of person that wants to just see dashboards and kind of see how data updates in real time, you'll be able to do that with the dashboard section, and you'll just tab through when it comes to daily reports or dashboards, appointments, encounters, patients, charges, claims, and AR, right? We talk a lot about AR here, especially at the end of the year with those aged outstanding claims. So you want to make sure you're utilizing this. I'm throwing a lot of information at everybody. If you want some more information, make sure you head to chirotouch.com, or if you can scan the QR code here at the end, you'll be able to dive in there with more detail for you. When Rebecca's talking about updating information and updating like the maintenance side of ChiroTouch, make sure you go down to the settings because that's where you'll get, it's very easy to get started with ChiroTouch. It's very easy to kind of transition from what you're currently using to ChiroTouch and kind of get rolling. And we do it all within the maintenance section. So you'll want to come in here and update all your billing settings. We'll update those fee schedules, everything within here. Make sure you're doing the provider settings, the user settings, just at the beginning to get everything up and running. But it's all simple. You do that all within here in the maintenance section. If you've got questions, please let us know. If you've got any concerns about anything within ChiroTouch, again, please let us know and go and contact us at our help center, right? Go and get help within ChiroTouch. We're there to help you. It is what we love to do, is to serve our clients and make ChiroTouch useful throughout the industry. So again, thank you so much. I'm going to pass it back over to Sawyer, let her finish up here, but I appreciate everyone's time today. Have a great rest of your day and have a great holiday season.
Alrighty, and thank you so much for that, Brian, and thank you to everyone again for joining today. If you'd like to learn more information about ChiroTouch or book a demo, feel free to scan the QR code here on the bottom left-hand side of the screen. And if you'd like to get connected with KMC University and book a discovery call with them, feel free to scan the QR code there as well. I hope everybody has an amazing holiday and a happy new year, and we will be seeing you guys in 2025. Thank you.